Shake your hands around, shake a little bit, get ready for that drink in about an hour. Feel good about it. Shake your legs a little bit, get the blood running through. And hopefully you're all awake and you can listen to Nnamdi and I have a great chat here with you all. So so this session really, Alain talked about the fertile soil for innovation this morning, and this session is really about that. It's about creating an enabling environment for grassroots entrepreneurs and also initiatives contributing to the digital health space, particularly within the African context. I'm speaking like most of you know me. My name is Anna Thompson-Quay, and I've been working with my great colleagues here and as part of the planning team for this forum, and also with Access Mobile International. I'm here to also introduce Nnamdi Oranye. Did I get your name right?
Got it correct.
Oh, thank you. Who really is the innovation guru, and on the African continent and more broadly also. He is the author of Africa's first book, Disrupting Africa, that chronicles the lives of innovators and entrepreneurs changing the African landscape. His many travels and business experience across the continent have greatly contributed to his huge optimism for the continent and its future. He features frequently as a presenter and chairperson at various conferences. I know you at WEF Africa. I was following some of those discussions, and particularly through LinkedIn, also from Leslie Ann, and some of the discussions around innovation and engagement coming out of WEF Africa. He's been named as, one of the 100 most influential names in Africa telecoms, media, ICT industry by the AfricaCom 100 Research Board. So Nnamdi, we welcome you here.
Thank you
welcome
very
you
much.
to Washington, D.C., and to our great group of public and private partners here.
Thank you very much. It's a pleasure being here.
So what we'll do is have a fireside chat. And what I'll do in about 10 minutes with Nnamdi is we'll have a few questions, hopefully just to give you more of a sense of what that fertile soil could look like, some ideas, some challenges, some experiences, and then to hear from you all in terms of any other questions or thoughts you may have for us. So I'll start off by asking, you Nnamdi, what is the role of African innovation, particularly within the health sector and then also more globally?
Excellent. It's a pleasure being here, and as Anna mentioned, I speak at quite a number of conferences, not just in the health space, but across various industries. And from a macro level, I don't know if you guys have seen the research by McKinsey says, I think the year 2040 or 2050, Africa would have the largest working population on the continent. And when you put that in perspective, you realize the population could be an asset or a liability. So from an asset point of view, if they're productive, it actually impacts the global landscape. If they're a liability, we have a problem. So it's not just an African problem, it's a global problem. And what I've been doing for the past couple of years, probably 4 or 5 years, is trying to chronicle the lives of innovators changing the African landscape, not just in the health sector, but across multiple industries. And I had a show on a radio station called Power FM in South Africa. And the logic there was to feature quite a number of African innovators we don't know about. I was very deliberate about the people I featured. I made sure they're sort of 3+ years old, scalable technology, having massive impact. And it was deliberate in the approach, one, to showcase that we actually have African innovators changing the landscape. And when we talk about these innovators changing the landscape, the first question that comes to mind is, we don't actually know about them. So as an example here, there's only one African innovator, Access Mobile here. But I've got a book of innovators who are changing the landscape. That if we don't know about them, we can't partner with them, we can't work with them. We talk a lot about data. There's a lot of conversation around data here for the continent. We have a representative from Safaricom as an example. To give you perspective on the innovation, I think there's stats saying that 45% of the GDP for the country flows through their platform. That's enough data for us to work off. So these innovators are starting to change not just the African landscape, but actually exporting this out into the global market. And we'll sort of talk about a few of these innovators in a bit. I hope that's sort of
yes, no, absolutely.
positions.
And actually building on that,
Yes.
you know, what do you see as some of the trends within the innovation space, you know, that we should be keeping an eye on, that we should probably sort of research a little bit more and sort of get them more into the fold in our discussions?
So from an innovation point of view, having access to the database of innovators on the continent gave me a view on certain trends. So, you know, we have these innovators doing impressive stuff, but one of the things we haven't actually done is start to put these guys together because they're in disparate locations. They're in Kenya, Sudan, Nigeria, and they're doing very well in their communities. But if you take it to a macro level up and say, give you an example, in South Africa, a company called Vula Mobile has developed an app. It was actually created by an ophthalmologist who struggled with the 4-hour trip he had to go to the rural village to detect cataracts in the community there, then drive back, and then 4 hours later, the grandma has to come drive into Cape Town to do a 20-minute surgery and 4 hours back. They came up with an app called Vula Mobile, very successful, 3+ years old in South Africa, doing quite well. The challenge that the grandmother has, though, is when she gets to the clinic, she has a problem paying because she hasn't got the cash. There's no health insurance. There's a company out of Kenya called MicroInsure. They've developed a way to provide free health insurance coverage on the back of airtime, as opposed to your traditional insurance mechanisms. So she gets the operation done. She has the challenge now. Where does she get the drugs from, or where she finds the drugs? How does she know it's not counterfeit drugs? We talk about counterfeit drugs in Africa being a huge challenge. A company out of Ghana called Sproxel has developed a way to detect cataracts in the back of, you sort of scratch a fall out of the packaging. She gets home, now she can see. What does she do? She traditionally has kerosene, but in Kenya, a company called M-Copper has developed a way of pay-as-you-go solar technology. Right. And she can now use this from an electricity point of view. But these innovators are actually disparate across the continent, and someone's got to step up and put them together to create this ecosystem. So when we think about funding or talking about pilots or projects, the conversation really should be, how do we put these innovators together? Because they exist, and they're doing great work, and how do we support them to scale? That's just an example of a trend that I've sort of picked up in my travels.
And, you know, actually just building off of that, and I like that kind of cycle that you kind of picture that image here. You know, with some of these innovators, you know, what are some of the challenges that they're facing?
Yeah, it's interesting. When I started off talking to innovators, I really thought it was funding. I thought they didn't have funding to scale. It's a real challenge. But what I found out very quickly is one, the funding exists on the continent. We have enough people with funds to, like yourselves here, who are looking to fund innovators. We have private equity funds looking to participate. But the real challenge most innovators face is access to opportunities, right? Access to growth markets. To growth markets. So for example, let's use Access Mobile, based out of Uganda. If they wanted to come into South Africa, as an example, it would be a huge challenge. There's regulatory conversations. There are probably partners they've got to go through to engage with. And at the back of that, how do they scale? So the funding comes in the back of that, right? So assuming they've got the funding, but not access to the markets, it's useless. So what I found with most of these innovators is the opportunities to expand, to grow, without having to worry about scale. So if you could, say, partner with a large corporate who's got a footprint across the continent, or an organization like Path, who can expose these innovators to roll out quickly, I think they'd appreciate it more than just access to funding.
That's actually very interesting because, you know, on one hand, as I've watched the space quite closely, you know, you tend to hear quite a bit around access to funding.
Yes.
But, you know, to hear this different perspective and the examples in terms of how some of these innovators can access these markets. And so are there other types of forums or ways in which they can tap into that, you know?
There is. The answer is yes. But I'll take it back to the macro conversation we talked about. So if you look at Africa as having a young population in about 10 to 20 years' time, which is not very far, by the way, it puts a different perspective on how we need to engage with Africa and also engage with innovators. And there's a trend that's coming up. I picked it up. It's going to be part of my next book, where Silicon Valley is coming into the continent. So we have the likes of Facebook, we have the likes of Amazon, we have the likes of WhatsApp on the continent. And Uber, give an example as Uber. So I travel from South Africa, I land in Washington, D.C., I turn on my Uber app, and I can get an Uber app, Uber taxi. Very fascinating that you can do that. And there's somehow Silicon Valley has managed to figure out Pan-African scale. So regardless whether I'm in Kenya, whether I'm in South Africa, whether I'm in Nairobi, I can actually use an Uber app. But if I ask the question of an innovator like Fido that's developed a way to test malaria using just peanut on the stick, very fascinating. In fact, I'm very surprised that they're not well known. So with malaria, it takes about 6 weeks to detect it, but with Fido, you pee on the stick, and in 25 minutes you actually know whether they have malaria or not. But if you think of those guys and say, how do they distribute from a Pan-African point of view from day one? It doesn't exist, right? But if you had Amazon, as an example, distributing a product, it exists today. Mm-hmm. I have a challenge with my book. I can't distribute my book, and the only real platform I've got is Amazon. If you thought of a vaccine being created for HIV, the real question for me is, how do we distribute that today? Not in 20 years' time, right now. So if you don't have that platform, when the vaccine comes out, it doesn't exist. But Silicon Valley somehow has figured it out. The conversations I'd like to hear when it comes to innovation is the distribution around it. How does that impact innovators, and how do we help them scale?
And so, just do you think that maybe perhaps cross-sector, cross-regional partnerships could be
essential? Absolutely essential. So I have the benefit of, one, not being a doctor, but I have the benefit of being reviewing innovation across multiple industries. So I go to the same conferences for finance, go to the same conferences around technology, health, education, and the themes are the same. So we hear public-private partnership comes up. We talk about regulation. We talk about using technology to improve lives. So the themes are there. But when you take a step back and look at the communities you're playing with, and I think KP mentioned this in this presentation, the community, let's say the grandma in the community doesn't sit and say, I want to be healthy today. And when I'm healthy, then I'll decide whether I want to send my kid to school, and after I send my kid to school, whether I'll invest in technology for education. This is a challenge they have now anyway. So when we actually talk about a cross-sector partnership, I think it's critical, right? So we should actually be having conversations with the technology space. We should have conversations with the telecom space, with the finance space. If the grandma is figuring out a way to take the drugs, how does she pay for it? How does she use mobile money as an example to pay for it? Those conversations for me need to start now as opposed to down the track. And I'd love to see more cross-sector conferences happening as opposed to just silo-type conferences.
So you mean including the innovators, though?
Including the innovators, yeah.
Absolutely.
I can expect to see more of them here.
This is the second time I've actually heard that at a forum like this. And one of the speakers actually predicted that by next year, there would be more innovators around the table having that dialogue. But I think that...
And I think it's important. And I'll tell you why that's important. So let's use the case of Ebola. We sort of talked about it today. One of the conversations I haven't heard yet is the case study of Nigeria. So in Nigeria, I think there was only 8 cases of Ebola, the Ebola outbreak. The question should be, how did they manage to do that? How did they manage to curb Ebola in a country with close to 200 million people? That's a fascinating case study we need to talk about. And when we start to bring the innovators and the people who actually explain, who help tackle that, I think it'll give a different perspective around health in certain countries.
Well, I'm sure you all have a few questions, but I'm dying to ask one last question here, which is, what's the flip side? What's the dark side to innovation?
Yeah, I actually wrote an article around this a while back, and it's actually stemmed from a project I worked on in South Africa. And you sort of create technology that makes sense, and you implement it, and it starts changing lives. The challenge to that is there's a dark side where we're actually displacing other industries. So I'll give you an example. The solution I implemented was in the parking space. You can use your app to pay for parking. But in South Africa, there are people who actually stand next to the parking stations and give you change. All right? And what happens is literally that person is displaced. And that person who is displaced has probably 4 or 5 mouths to feed, and there's a compounded effect. That's one of the dark sides to it. And you start to look at industries that are being displaced from sort of health technology point of view. It might work that the project or the pilot is successful, but you've actually disrupted an entire ecosystem. So the kind of conversation that needs to happen is saying, we're disrupting this ecosystem, but how do we bring them into the fold? So I think Africa, we sort of have, I want to call it a fragile economy, but I don't think we're strong enough to have disruption when people are being displaced without them being brought back into the fold. When we talk about health type innovation, I think the conversation needs to actually start to bring people who are disrupted into the fold. That's one of the dark sides to innovation on the continent.
Which happens to be one of my favorite apps, actually. I was at table 1, so excited about my parking app.
Yeah.
I kept increasing the time. But that's a very good insight, because, looking at these, high unemployment rates in a number of countries that we face, as we drive innovation, how do we think about ways in which we could, as you're saying, get them into the fold, or look at finding other types of opportunities in terms of other income-generating opportunities for these individuals. Fascinating. I've learned quite a bit. So I'm about 6 minutes away, and you'll still get your drinks, but I'm sure you have a few questions, and I'm happy to take them.
I'd be interested in another potential disruptive outcome of innovation, particularly in the health sector. As we've seen this in a place I know better than I know Africa, which is India, over the last 30 years, where there were a lot of the same challenges in health provision 30, 40 years ago, particularly in rural India. And what's come in to take the place of lack of services has been a private healthcare industry. Now, there are all sorts of issues around the quality of that care and so forth, but privatization of health care through innovation has really transformed India in many ways. And so my question for you is, in Africa, that could be quite disruptive. Healthcare is delivered primarily through donor programs and through governments and faith-based organizations. If the private sector, sectors like what we've heard, opportunities like we heard from KP, become increasingly productive and increasingly valued, do you see any potential downside from that and its impact on the existing system? Or maybe that's a good thing.
I think it's a great thing. The reality is they exist today. They exist today. They're scaling at rates we haven't envisaged. The reality, the fact that we're not talking about them doesn't mean it isn't happening. And what I think would essentially happen, there might be a confluence between sort of the public sector and the private sector, with the innovators coming together. And the fact that we haven't got infrastructure similar to the West means, for me, it's a great thing to actually have these guys roll out quickly. I was at a conference in Durban last week where I came across a company called Kumi. They've figured out a way to have they call it the hospital in the box. They have a box that you can plug in any city on the continent, plug into GPRS or 3G technology, and any health worker can actually use that. For me, that's fantastic news, and I wouldn't wait for the public sector to actually roll that out if it means advancing health in the continent.
I've got a question for you, Nnamdi. We didn't get into it in the other panel, but I'm curious to get your point of view on this issue of crowding out of innovators by foreign aid. So if we look at local innovations in African countries and we look at the dynamics with foreign aid, what's your point of view on how you see innovators navigating that dynamic?
Good question, and I wouldn't profess to be an expert in foreign aid. I'm relatively one in the innovation space. I think the big challenge foreign aid has on the continent is most people actually don't know about the innovators on the continent. That's a starting point. So if you don't know about them, you can't partner with them, or you can't help or assist. And one of the roles I'm trying to play is actually change that narrative to say, when you come into the continent, here's a heat map of all the innovators doing some impressive stuff, both in the health industry and outside of that, supporting services. I think that's the first bit. The second then is to present, I think Ola Shopit's tried to explain this, to say we present a strategy that the health or the foreign aid can actually participate in, as opposed to the other way around, which is coming in with a preconceived solution that might or might not work. What we probably haven't done very well is presenting that solution, but I see the narrative changing now. And when you present that solution and say, this is how we want you to participate and help, I think we'll get to better outcomes as opposed to lots of pilots. Because we've actually passed the pilot stage. I can tell you that on the continent, we've passed the pilot stage. We have innovators who are fixing African problems an African way. And what needs to happen now is when aid comes in is to support that to scale. And when you look at the continents, the problems are actually the same. Malaria in Mozambique is similar to malaria in Nigeria. So if you have malaria sorted, or you have a solution in malaria that's effective, transported directly to Mozambique, it's almost plug and play. And what we need to do as a continent, I think, is to provide that framework to say, we want assistance in this manner, and we expect you to help us get to that next stage.
Any other questions? Comments? You all still awake? Simon.
No, a comment really, but I'll start with the big picture question, Nnamdi, which was great. Thank you very much. But you talked about basically the demographic dividend versus the youth bulge,
yes.
The challenge. Yeah. And I want to know how optimistic you are, because it seems to me that's, when we talk about foreign aid is increasingly less important on the continent of Africa, which is a great thing, because the amount of foreign aid is a minuscule amount of total resources. And I think foreign aid is getting it, that African solutions for African problems and African innovations for those problems is absolutely right, and want to be supportive. They have a challenge still talking to their constituents, taxpayers, because taxpayers' image of Africa is a very old image of Africa. Right. So in the UK, for example, there was huge outcries over British taxpayers' money being used to support things that I believe are really important, which are shopping malls and the jobs that build them, and middle-class housing, and a whole range of things around Nairobi that just doesn't fit with the image of many taxpayers. So we've got a communication job to do at home that says, resources that support these solutions are important for us. And so, something that I think your book and the heat map and network of innovators is huge. If we can marry that in some sort of dynamic deal book fashion that looks at, these are challenges, these are possible innovators, and we start making those connections. And I know some of these happen, But I think there's an increasing appetite from all sectors. I've just come back from Silicon Valley, where I see real appetite, and you were talking about their investments in Africa. I mean, I left the donor world a couple of years ago, but I know there's an increasing attention on private sector solutions and public-private sector solutions. So, good on you. I think it's really important, and the networking would be great in terms of that heat map. But just where is your sentiment around that dividend versus bulge, and just that challenge you had around the parking meters and the people, sort of taking the money and the unintended consequences, if you like, of innovation. I mean, that's here as well. That's going on in this country right now, and we can blame immigration and we can blame all sorts of things, but automation, AI, machine learning, and I don't think Jessica's in the room anymore, but yesterday we were talking, and one of the things people are thinking about is the future of work. It's going to be very different. So just a quick sentiment about how optimistic you are around this dividend versus bulge.
Yeah, I'm very optimistic about it. And at a conference, the best description I had in the intro was calling me an Afro-tech optimist. And it was fascinating. And the reason why I'm very optimistic about it is, one, being very passionate about the continent and actually seeing people do things, and the power of technology. When you have that confluence, for me, is phenomenal. M-Pesa, as an example, is one case in point that this is viable. That being said, I'll give an example. M-Pesa is 10 years old, so it's no longer a startup. We have other startups coming up to change that narrative. And from an optimistic point of view, outside of health, as an example, I've come across enough innovators doing impressive work that I know for sure we're going to get there. And when we talk about aid or funding coming into that, I think there's a new generation of innovators realizing that we actually have a different narrative, and we want people to play into that narrative as opposed to the other way around. When we look at the continent, I think we're very quickly moving past a needs-based focus. Needs-based is healthcare, education. I think we have solutions for that. What I feel and see now is people looking at forward-thinking initiatives. So how do we block the brain drain out of the continent? So people come out to, say, the US or the UK to study. How do we make sure they remain on the continent? I think those conversations are already happening. So what most innovators, the challenge they face is when third parties come in to assist, they're still in the very needs-based approach, as opposed to say, how do we move this generation to the next level? And I think with time, the only way to actually block that is, or fix that is, by promoting the African innovators. When you come into the continent, you know them already. You know what they're doing. You know their scale. You know their input. You talk about data. It's very easy to look at someone like Access Mobile, 2 million users, use that data as opposed to starting from scratch. And I think that where I play and try to fit in is to actually promote those African innovations. So when we're at a conference like this, or you're coming into the continent, at least have a very better view of what the landscape is like as opposed to the images we saw 10, 15 years ago.
Okay, I have one last question for you, which is, when and where can we find this heat map?
Very interesting question. It's in the book.
It's in the book. Where can we find the book? On Amazon?
I'll find it on Amazon. You can find it on Amazon. But I think what I'd like to do above and beyond the book now is to take that data and make it readily accessible. And I was sort of speaking to Neil from Tabulo earlier. I think the innovation story is bigger than me. The other players who have far better ideas on how to utilize that heat map. Give an example. If you take, say, malaria as a problem. So you take malaria map, cell phone penetration. Very quickly on the continent, you can see where the heat spots are. And you look at cities that have that heat spot, and you look at the innovators in that city who is fixing the problem. I can't do that myself. Someone like the Tabulo can. And when we come into play in the continent, that's what I want to see. And I'm hoping with time, the book will be a catalyst for people to start having those kind of conversations.
Thank you very much. Thank you all.
Thank you very much.